Hi dear friends, this is Dr. Kadam Nagpal, Senior Consultant Neurologist at PSRI Hospital. So on the occasion of World Alzheimer's Day, we are just remembering those patients who have got difficulty to remember things. That means patients who suffer from dementia, mostly they are beyond 65 years of age, and the most common dementia what we often encounter is Alzheimer's disease. So what exactly happens in Alzheimer's? How can we understand the symptomatology of the ailment, how to address basic issues of such patients, and how to treat and how to prevent such an ailment which requires a lot of support and a lot of patience and support from the caregivers. So I'll be just like sensitizing each one of you about the same. So Alzheimer's dementia is the most common form of dementia which is being seen in more than 65 years of age of population. Dementia is basically a basket of symptoms where Alzheimer's disease is one of the most common subtype. So dementia implies that any person who has got difficulty in his cognitive abilities and which manifest in decrease in his previous level of functioning is what we call it as cognitive decline or dementia. So in Alzheimer's, what exactly happens that there is a deposition of an abnormal protein, what we call it as beta amyloid plaques and neurofibrillary tangles. So this basically happens in the temporal areas of the brain, which turn out to be as a graveyard of amyloid plaques and neurofibrillary tangles. So what these things done that the deposition of protein and these tangles just damage the area which is being very important for episodic memory or a short-term memory. So such patients often come out with a short-term memory impairment. Short-term memory impairment is the first symptom where the patient of Alzheimer's might just come to a neurology OPD, and then subsequently we find that other symptoms also develop, such as difficulty in navigation, having some kind of visuospatial disorientation. They might just have difficulty in recognizing bathroom for a kitchen or vice versa. They might be having difficulty in traversing between familiar surroundings, such as even a homely surrounding they might be just like very unfamiliar with in time to come. They have often have difficulties with recognizing their near and dear ones, their relatives. They have difficulty in naming, and eventually a very significant language dysfunction also comes into place, where such patients are always disoriented. They're not able to convey, they're not able to comprehend what the other person is often saying, and eventually they just become absolutely mute. When the Alzheimer's advances from a mild stage to a severe stage, we see that patients' activities of daily living are very severely hampered. They are not able to even walk short distances. They are very slow in their activities, and eventually become urinary incontinent and bedbound in the severe stages. So the treatment often just involves certain medications which just slow the ailment, especially once given in the early aspects of the disease. However, there is no proper curative treatment for it which can reverse the entire process. It's a neurodegenerative ailment, and we often let our patients know that it will progress in future, and they have to be dependent over the others. They cannot make any financial decisions, they cannot take any financial calls to support their family, and we often let their family members know of the same. So these are the patients who are mostly dependent on their caregivers, and we often sensitize how they have to be just managed, because early into the ailment, when the patient is absolutely mobile, a patient who might be having a navigational difficulty might just wander anywhere else and might just be lost, and he would be having a lot of difficulty in getting back to his household surroundings. So we ask our patients that attendants that they should be at least carrying some visiting cards of their near and dear one. They should be having a mobile phone, they should be having a GPS navigation device, so that even if they forget where they are, at least their near and dear ones can trace their location and put them to safety. So simultaneously, we let our attendants as well as the patient be aware that falls should always be avoided. So once the Alzheimer becomes severe in the disease progression, patients become confined to their room or even to their bed. So falls should always be avoided, infections should always be preemptively treated. As far as prevention of this ailment is being concerned, as I have mentioned, it's a neurodegenerative ailment, it will progress. It's difficult to prevent, but there have been a lot of trials where good lifestyle, avoidance of smoking, alcohol, and adequate exercise often result in good memory and good brain health. Even proper, there have been trials that proper sleeping time also result in a good brain health, and it might just avoid Alzheimer's in future. So my message to all my patients is, and even the caregivers, is that we have to understand this ailment can just involve anybody in their elderly age group beyond 65 years of age. Attendants and family members have to be aware and vigilant enough about these symptoms, and whenever such symptoms occur, they have to get in touch with the neurologist so that adequate and appropriate treatment can be started at the earliest, and all sorts of measures should be taken so that we can just make the patient steady and composed in time to come. And this is what my message would be to the patient as well as their attendants. Thank you.